البرنامج الاجتماعي الذي يستوحي جماله منكم ويعود إليكم راجيا الفوائد. أعزائي، الكثير من الناس وخاصة الرجال يعانون من مشاكل تساقط الشعر. الليلة يقدم لكم بعض الحلول المفيدة والنصائح الثمينة يشاركنا بها الطبيب والاختصاصي الشهير ويليام ييتس. هو مشهور بطريقته الجديدة في زرع الشعر عبر الجهاز الآلي روبوت. أهلا وسهلا، وتعالوا نرحب سويا بضيفنا القادم من شيكاغو الدكتور ويليام ييتس. Dr. William, أهلا وسهلا.
Thank you, Dr. William, for being here. Dr. Yates, what is your background as a doctor?
I'm a medical doctor. I first started out, I went to Northwestern Medical School. I'm from Chicago. I was a cancer surgeon and a trauma surgeon, but I made a career shift. For the past 10 years, I do hair transplants only, and I treat patients with surgical hair loss and non-surgical, meaning we do hair transplants and we do other things with people with hair loss. But I'm a hair surgeon, and that's all I do now.
اوكي، فاذا ضيفنا جراح بعمليات زرع الشعر في الفتره الاخيره، ولكنه طبيب طب عام بشكل عام. Dr. Yates, I wanted to ask you, what drew you to this field, to hair transplant surgery? It's you must have some sort of a passion for it.
I have quite a passion for it. When I was growing up, most hair loss comes from genetics. Okay. My father's side and my mother's side, both, they were losing, their parents losing their hair. I was like balding in my early 20s. And even though I was in medical school, I always did very well in school. It just hurt me inside to be losing my hair when all my friends had a lot of hair.
So there is that personal motive?
Very personal, very personal, because I know how much people, men and women, are suffering basically in silence. They don't talk about it. There was nothing I talked about, but I was very, very upset and kind of lost a lot of confidence because my hair was thinning.
Oh, so your patients are in the hands of someone who's very understanding.
Yes.
Coming from the same boat in a way.
Yes, I always tell my patients that there's nothing that I recommend for them that or do to them that I have not done to myself. So everything they're feeling or that I'm doing, I felt and done myself.
أعزائي، فإذا جوابا على سؤالنا ما هو الشيء اللي خلى دكتور ويليام يتحمس لموضوع زراعة الشعر؟ شارك معنا أنه هو تجربته شخصية. هو كان عنده معاناة أنه خسر شعره بعمر صغير جدا، وهذا الشيء شجعه أنه ياخذ منحى الاختصاص ويعمل بحوث بزراعة الشعر بأحدث الطرق.
In your opinion, Dr. Yates, what are in general the causes for hair loss, and is it true that being under too much stress can increase or make the hair fall off?
Yeah, well, the main cause of hair loss that we see is due to genetics. Okay, there are some people that have disease processes like anemia, thyroid problems, or what's called polycystic ovarian disease that can have hair loss. But for the most part, it's genetic. It can come from your mother's side or your father's side. It's used to be said it comes from the mom's side, either side. As far as the stress is concerned, yes, stress can make you lose your hair or shed it, but if you don't have the genetics to continue losing, that hair will grow back.
So it's not the sole reason?
No.
Stress cannot be a reason on its own. It has to be...
You have to have the right chemical composition with the genetics for that to continue on. It's kind of like the accelerant. Like I say, it's like putting fuel in a fire. It's like the balding into the fire. The stress puts the fuel in, the fire gets bigger. The baldness gets worse. But if you don't have the gene, once the stress is over, your hair will grow back, just as good as it was before.
فإذا أعزائي، جواب الدكتور ويليام ييتس على سؤال أسباب تساقط الشعر، وإذا ما كان الضغط أو القلق النفسي له سبب في تزايد تساقط الشعر، أجاب الدكتور ييتس أنه عامل الوراثة أهم عامل. يعني حتى لو واحد عنده ستريس، لما يروح عامل الستريس يرجع الشعر يتنشط. لكن إذا كان في عامل وراثي فما له علاقة القلق والضغط النفسي بعملية تساقط الشعر.
So what is the science behind hair transplant?
Okay, great question. The science is someone figured out back in 1959 that the hair in the back of the head is a different type of hair than the hair on top of the head. The hair in the back of the head is resistant to balding. So it has nothing to do with the scalp. Like a lot of people will think since men and women thin on top, maybe you're not getting enough circulation. Maybe there's not enough air hitting your scalp, things like that. Totally not true. The hair around the sides and the back is resistant to balding. The hair on top is very susceptible to a hormone that makes the hair goes away that everyone has in their body. And that's the basic science. So when we take hair from the back in a hair transplant and move it to the front, that hair lasts forever. That's why it's a permanent solution. The hair that we remove from the hair transplant and plant up front will grow just like it did in the back. It grows, it's your hair, it's your own living hair, you get it cut, you style it, you do whatever you want.
But it's stronger.
Yes, it's stronger and it will not fall out because it's resistant to that whole balding process.
Wow, that's interesting.
Yeah, it's very interesting. I mean, it took somebody gutsy back in 1959 to say to a patient, hey, you got good hair here, this hair up here is no good, let's take it and put some up there. So they just punched out some hair and put it up there and they said, oh my God, the hair grew and it stayed and it didn't fall out. So that started the science of hair transplantation.
Wow. Dr. Yates, you're probably familiar with this. You probably hear a lot of complaints. What is it, or why is it that people think, when they think of hair transplants, they always think they have these negative images that, oh, there are images of plugs, dull hair, and hair transplant. There's a fear.
Yeah.
Okay, why?
Because that's kind of the hair transplants of old. What it actually proves is that the hair that was put in is permanent. These are hair transplants that were done in the beginning of the field, around even as late as 1980s. People used to take plugs out of the back and put them up front. And it looks like, we call it toothbrush hair. It looks like toothbrush or doll's hair. That's just
Is it noticeable?
Yes, it's very noticeable. We could see it across the street. Like you go into a party or anything, you could notice, you'll say, oh, that guy had a hair transplant. But thank goodness he had one years ago. That's just like old medicine in the hospital. Things that were done like in 1980 and 2000 whatever are done differently.
So no more toothbrushes in the hair?
No more toothbrush hair. No one, most of the people that have had hair transplants, no one will ever know.
So what has changed in general, if you can briefly fill us in, what has changed in terms of a technological approach that makes having hair transplant more desirable? Like, did the fear deteriorate now?
Oh yeah, just like what you said, the plug thing is over. So many people have hair transplants you can't tell up front. I've had several hair transplants you can't tell. There are a lot of people you work with that have had hair transplants you can't tell. The other thing is, in the old hair transplants, there used to be a long scar in the back of the head. And that's kind of was a deterrent to a lot of people because you have to cut out a lot of the scalp and then sew it back together. And that's a lot of pain, a lot of problems. Now we can take out each hair individually, punch it out, and then place it up top. So there's less pain, there's hardly any scarring in the back, so you can wear your hair very short and nobody will know that you had a hair transplant. And there are no plugs up front. So there's no evidence other than you have hair now that you had a hair transplant.
Well, that brings me to my main point. We always hear about these robotic or robots used in medicine, in the medicine field. What is the RTAS, or what does it represent, and how is it used for hair transplant?
Yeah.
What is this method?
Yeah, robots are used kind of in all medicine now. I mean, like in the hospital, we use them to do prostate surgery, and that same science has been used now for hair transplant surgery. The robot, what it actually does is it individually picks out the best hair to remove in the back, remembering that this hair won't fall out, and it actually scans the whole head, is able to pick out the best hair to remove that will survive by different algorithms, and punches it out with a tiny little punch.
Also, the robots are assessing, like
Yes.
doing some sort of assessment,
They're doing
choosing
it.
the healthier,
Yes.
more
Follicles.
prone hair
Yes.
to grow
Yes.
follicle, and then
Right.
picking and selecting that specific one.
That's exactly what it's doing.
Wow.
It's
That's-
looking, it takes a picture of the head, and it scans, and through algorithms, which are way above even my understanding,
Okay.
picks out the hair. Even though all the hair in the back is resistant to balding, still some is better than other.
Okay.
So it picks out the better quality hair in the back and allows that to be extracted, kind of extracts that hair, and that's the hair that we use to transplant up front. Because the rule of a hair transplant is basically supply versus demand.
Oh.
You know, so it's how much supply, because you can't take all the hair back here, then you'll be bald in the back and have hair in the front. Because when you have a hair transplant, you don't get any more hair. It's movement of hair from here to there. So this part will become a little thinner. That's the whole trick of the whole science. It's kind of like art. You have to make this thinner, but you have to know how to do it.
Keep it normal.
Yes, looking normal, you know, and move that to the other part of the scalp to make this thicker. Because nobody can grow any more hair.
The demand borrows from the supply, but the supply still needs to look good.
Exactly.
Oh, okay. That's
And there's
interesting.
there's fixed demand. So you want to get the best out of this demand you can.
فإذا باختصار دكتور ييتس شرح لنا عملية كيف يعمل الرجل الآلي أو المجسم الآلي الصغير، الجهاز الذي يحصل على قدرة نظرية تفوق قدرة العين البشرية على اختيار وتقييم ماهية الشعرة النشيطة أو الشعرة الصحية واقتطاعها من المنطقة الخلفية من الرأس ثم زرعها في مقدمة الرأس وعبر الطريقة التي تعرف ب ARTAS وهي استعمال الجهاز الآلي لاقتطاع المنطقة التي ينمو فيها الشعر الفوليكولار اريا وزرعها في المقدمة بدون آلام وبأقل عدد ممكن من الآثار الجانبية السلبية.
Hi, I'm Dr. William Yates, and what I'd like to do today is show you a little bit about what's new in hair transplantation. Right beside me here is the ARTAS. This is an incredible robotic device that actually removes hair in the back of the head of a patient. This is called the donor area. It maps the area through algorithms, picks out the best hair that should be removed, and actually punches the hair one by one as the patient will sit in the chair like this. The robot maps and sequences the back of the head and removes the best hair in a mosaic pattern so nobody can tell that it's done. Now, why is this good? In the history of hair transplantation, the way that the hair is removed from the back normally is by a large cut that goes from ear to ear. But what this machine will do for you, picks out the hair one by one, then we go back and actually pluck out the hair with the hair bulb, which is the root. The surgeon, which in this case is myself, artistically designs the hairline, and then that hair is placed in the front the same way the hair is growing. Now, why is this important? Because everyone always asks me, is this going to look natural? Yes, no one will know you had a hair transplant. Then the next question comes in, well, how come I see my neighbor cutting the grass and he has big plugs in his hair? What's wrong there? Okay, the answer is, most likely your neighbor had the hair transplant done in 1974. This is 2013, so we've come a long way. You will get a quality hair transplant without the long cut, without stitches, without the long scar, without the added discomfort in the back. Because in the old way, when you take out a piece of the scalp, you have to sew it together. Sewing it together creates tension, which creates what? Creates pain. When we move hair follicle by follicle, no one will know. This is kind of the Bentley of hair transplantation, the ARTAS robotic system. Now, it doesn't work by itself, so you have to have somebody who understands what it takes to make the hair look natural up front. So that's what I do. The three most common questions I get from every patient. Dr. Yates, will this look natural? The reason that a lot of hair transplants do not look natural is because the grafts in the front are too thick. The grafts have to be thin in the front, just like a natural hairline. We know that a natural hairline is made up of 1 hair grafts and 2 hair grafts. All we do, if you're a good hair transplant surgeon or a good painter or anything, what do? You imitate nature. All I do is imitate nature. So we do 1 and 2 hair in the front, and then thicker grafts as we go back. Number 2, will it hurt? On a scale of 1 to 10 of major surgery, this is a 1 or a 1.5. Okay? It's a little bit more stressful than a haircut. And then the other thing patients always want to know, well, why should they come to me or any other surgeon over the other? I've been doing hair transplants exclusively, now going on 9 years. That's all I do. I'm a board certified surgeon. Before this, I was an ICU surgeon. Now I'm board certified, or what we call a diplomat, in the American Board of Hair Restoration. I hope I've answered all your questions. It's a great option. If you have good donor hair, it's going to be natural, it's going to be permanent, and it's going to be the best thing you could ever do for yourself. So this is Dr. Yates in Chicago. Thank you very much.
Many people ask or would like to know, after a hair transplant, what should they expect? What are some side effects? Would the hair fall out again, etc.?
Good.
What would you say to that?
The hardest thing after a hair transplant is it's not immediate gratification. Like everybody wants, immediate gratification. Like, when you lose weight, you want to, like lose 10 pounds in 2 days. Same thing with the hair transplant. You want the hair to show up quick. It takes about 6 months from the day you have that hair transplant for that hair to really look like something that you think you've gotten your money's worth.
Can you dye that hair?
Yes.
It comes out?
Yes.
It grows?
Once that hair comes out, whatever you did to it in the back of your head, you can do to it in the front. So that means if you dyed it, you can do anything. There are no rules. It's your hair, it's planted, it takes root. There's no special medicine, no special treatment that you need to do after the transplant. As far as side effects from the transplant, one of the most common things people get is some swelling of the face after the transplant that usually goes away in the first week. But there's no real serious side effects because it's just skin surgery. So it's just basically dealing with the skin, which is just millimeters deep. You're not going near the skull. You're not going near the brain, near the eye, or any major organ. So it's very few side effects.
Oh, is it different for women? And do you do it for women? And what percentage of your patients are women?
Yeah, it's a great question.
Clients?
Yeah, patients, clients. Every year, more and more women kind of seek me out. Okay, and we know statistically in the United States, about 40 million women have hair loss. But and most of them don't know what to do. But I'd say about 30% of my patients are female patients. Female hair loss is a little different than male hair loss because in female patients, sometimes the back, the supply part, will get a little too thin that you can't really borrow from here to move up here. Sometimes in men, usually this part back here stays pretty dense, even though they've lost up here. But in female pattern hair loss, sometimes we notice that the thinning is diffuse, even the back is thin too. So we can't take hair here to move here because it won't leave a good result in the back.
So what happens in this case? Do you take it from other parts of the body?
Usually we won't take it from
For
anywhere.
any, men or women, do you
Okay.
take it from other parts of the body?
Yeah.
If the back is thinning as well?
Say for instance, for the first hair transplant in a man, if the man's back of the head is thinning really bad and doesn't have enough supply, we wouldn't do a transplant because we do take hair from the beard and the chest on men after we've exhausted all the hair from here. But we always want to at least start with some of this hair to do the hairline and so forth because you don't want to use beard hair and chest hair because it's a different grade of hair up in the front. So they have to have at least enough hair to get the transplant going before we start using other hair. In females, if this hair is not good, we'll recommend non-surgical methods. There are other things that are FDA approved with real science behind it that can grow your hair, So that's what we'd recommend.
جوابا على سؤال إمكانية زرع الشعر أخذه من مناطق أخرى غير مؤخرة الرأس، يجيب الدكتور ويليام يقول لنا أنه ممكن ولكن يفضل أن تكون من منطقة نمو الشعر في المنطقة الخلفية من الرأس.
That there are no hopes or there is no way that it can be done surgically and they're going to do it via medication or whatever. Is there anything as the concept of donating hair?
Okay.
Donating other organs?
Good question. Just like in the hospital, say if I needed a kidney, You know, maybe if you and I matched blood types with somebody, you could give a kidney to somebody else. But with hair, no. You know, because you have to be on so much medicine to prevent rejection of the hair, and this isn't covered by insurance, nobody would pay for it. So it hasn't even been studied. It probably could be done, but it hasn't been studied because nobody will pay for someone to take the medicine so the hair won't reject. Possibly in identical twins, the hair could be transplanted from one to the other. But usually if they're identical, both are bald because they have identical genes.
فإذا ينصحنا الدكتور ويليام ييتس أنه إذا كان الشخص غير مؤهل مؤهل لأنه يكون عنده المنطقة الخلفية للشعر جاهزة للاقتلاع لزرعها في المقدمة، ينصحه عندها إذن الدكتور ييتس بإجراء إجراءات أخرى كأخذ فيتامينات ومقويات وضعية أو كل حالة تختلف عن الثانية. فأهم شيء إنه يكون عنده شعر غزير وصحي في مؤخرة الرأس.
Dr. Yates, what happens in cases where with people with scars and burn marks? Do you perform on them?
Yes, all the times. Scar tissue isn't the best tissue to plant hair into because it's like scar tissue has bad blood supply, but we can transplant good healthy hair into scars and get good results. We do it all the time for people that have like scars, you know, like men that have scars here in the lip that want to grow a mustache or scars up on the scalp. We do it all the time, you know.
And it's successful.
Yeah, it's pretty successful. It's not as successful as doing it on the scalp, but yeah, it can be done.
So what makes people ideal for hair transplant?
Okay, the ideal candidate is somebody that has good donor, which means good supply. When they come into the office, usually the process is I meet with them. We discuss like their health history to see if they've been losing hair from some stressors in life, or they have a disease process, you know, they're losing hair, or is it like what we always see, is it from the family? So once I determine that it's something I can't correct by just, you know, medication or something, then it's examining them to look at the donor, to see the quality of the donor. If somebody has dense hair back here and a lot of hair back here, that makes them a very good candidate.
And what you mean by the donor is the back?
The back and the sides. This is called permanent hair.
Supply area.
Yeah, this is supply, right. So you had to keep it simple. It's like economics 101. So this is supply, everything
else.
else.
George Bernard Shaw,
Yeah.
he used to say
Exactly.
his famous quote.
Right. So it's basically supply and demand. So if the supply is good, you know, everybody has demand. You know, it's a question of telling the patient sometimes they don't have enough supply to do what they want to do, but they can still do something to frame the face, because everything is framing the face. You know, we
So
can't.
at least there's something that could be done.
Yes.
But for someone who doesn't have it, they should seek other methods.
Yes. If you don't have good supply, then we're already going to start talking about other things. Yes, other things you can do to help with your hair, if anything.
Well, Dr. Yates, we learned so much today, and I would like to really thank you on my behalf of my viewers, and we wish you the best of success, the robotic methods, your enthusiasm for this procedure. We just wish you the best.
Oh, okay. Thank you. Thank you for having me on.
أعزائي أشكركم شكر جزيل جدا في نهاية هذه الحلقة. لقد استفدنا استفادة كبيرة من وجود الدكتور ويليام ييتس معنا الليلة. نتمنى له النجاح دائما، ونتمنى لكم النجاح في عملية زرع الشعر وفي حلول كل المشاكل التي تعانون منها. تصبحون على ألف خير.